That video at the start, it put me in a very depressed mood. You know, I wasn't too delighted to see the realities of our healthcare failings being put up like that, just before we talk like this. But I guess that's why we're here, to say that even though there are a lot of challenges, but the opportunities exist for us to improve it, and the people to make that happen are in this room. Today I'll be talking about innovation in practice, looking at the African healthcare landscape. All right. Some disclosures, you've already kind of read my bio, but it's important that I disclose because it does color some of the things that I will say and helps you to appreciate the bias that I have. First is that I run a venture-backed technology company. Second is that we partner with many health management organizations or health maintenance organizations, HMOs, and pharma companies. And finally, we have received grant funding from Google and Swiss Re. So anything I say, look at it through those lenses. Okay, so what is innovation? Take a second to think about that. What is innovation? The definition that I like is this formula, essentially, that innovation is invention plus adoption. So for something to be innovative, it has to be invented in that, yes, it's a new way to do things, or it's a new procedure, it's a new product, it's a new service, but it also must be adopted. So there must be an appreciable number of people that use that invention. It is only then that you can say something is innovative. So let's break that down then and look at invention itself, first of all, before we speak about adoption, to then ultimately arrive at innovation. So with invention, where does a lot of healthcare invention happen at the moment? Anybody care to guess? Please, I'm open to have this being actually a two-way thing. Somebody talks Nigeria. Universities, absolutely. Anywhere else?
Research labs.
Research labs, absolutely. Okay, so sources of healthcare innovation essentially these days are in research labs and universities. And if we look to the US, which is arguably the most inventive country in the world, where this is between 1996 and 2015, if you look at the arrow, they had 380,000 inventions disclosed. 380,000 inventions. And for patents, they had 80,000 patents in that time. That's mind-boggling. That's a lot. And what has that done to the economy? So there's some other numbers there, not as important. But with $1.3 trillion added to their GDP, over 4.3 million jobs. So invention has actually spurred the economy of the US. And a lot of that actually happens, like we said, in universities and research institutes. How do we compare in Africa? I can see the looks of people's faces already. So this is a graph of inventions and patents in Africa from 1970 to 2010. There's such a wide disparity, so this is looking at sub-Saharan Africa. There's such a wide disparity within sub-Saharan Africa in that essentially South Africa is literally the only place where you get a lot of invention happening. And so if you see the arrow at the top, that is for inventions made in South Africa alone. And you see the peak is somewhere around 1,400 back in sort of the 80s. That's inventions. The rest of sub-Saharan Africa is in the kind of less than 400 region. Now, if you look beneath that, it's looking at biological inventions in South Africa. And we see that that has been climbing up over time to a maximum of sort of 60 in 2008, whereas the rest of Africa, not really doing that great. So we are coming from, in the US, we have 380,000 to Africa, where you're getting, at best, 2,000, a year. So massive disparity. So, come back again to start about innovation, right? It's invention and adoption. So to improve the adoption or to improve innovation, we've got to think in these two lines: is increase the amount of invention that we have by investing in research. So we support PhDs, research institutes, universities, and with adoption, invest in more startups and support them as they work to improve the adoption of technology to improve healthcare. So finally, in closing, the question that you're probably asking yourself is, considering all of this, what can I do to aid that innovation in practice? And I have a simple formula that I've kind of used when speaking about the innovators in this talk. And that is around redefining what PPP means. So I spoke about it a couple of days ago, and I want to recontrast that. Is that we all need to, wherever we work, especially if you're in healthcare provision, think about one problem or pain points that you have. Find a partner, a technology partner that can help you figure out a solution for that problem that you have. If you don't know any, or you don't have access, I know hundreds of them. I literally know hundreds of them. And I'm able to connect you with anybody that will be able, with a few people actually, that will be able to help you to figure out what solution you need to solve that problem or pain point that you have. And then finally, this is what's most important, because we have this habit of speaking a lot and not doing anything. I want you to commit to one pilot. Okay? So that's PPP. One problem, one partner, and one pilot. As we do these things, as we do this thing, I know that we will have far more innovation in practice. We will see our healthcare improve. And that depressing story at the start can start to change. Because we, like I said, are in this room, are the ones that will change it and make our healthcare better.
Thank you very much. We just leave room for one question or two max because of time. We started a bit late, so we're trying to reconfigure our timetable. So if you have any questions, just signify by raise of hand, and then we'll bring the mic to you. Okay, sir. We have one.
Good afternoon, everyone. My interest is about that zip line that you have just discussed with us now. I want to know the cost implication, because when you are taking drugs from one particular location to another location, yeah, it involves a lot of money. And then who is going to finance this? Or how do you package the whole scenario and just give me an enlightenment? I need an enlightenment about that. That's it.
Okay, thank you so much. So, I mean, I don't work for Zipline, so I don't know the exact figures. But my understanding is that in trying to reach remote areas, you build roads, for instance, to get things over there. You need to do a lot of infrastructure that can take a lot of time, effort, and politics as well. And my understanding is that state ministries of health find that in some instances it can be more cost effective to actually use this technology to get supplies to where they need to be. Now, I think it's up to the individual, states to do that math and figure it out. But there is, some impact reports that I've read that says that compared to having to build infrastructure, zipline can be cost effective. But I think it depends on the specific areas. For instance, in Rwanda is quite hilly and there's remote areas, so it made a lot of sense there. There's some states where it doesn't make sense. I'm from Abuja State, I don't think it will make sense. Because we have decent roads and the farthest place, from the capital, from Uyo is maybe 2.5, 3 hours. So in Abuja State, it wouldn't make a lot of sense. But in Cross River, for instance, they've got very remote communities, and I hear that they're doing things with zipline. So it depends on the specific scenario. What of Lagos? It's up to Lagos State to figure out.
Okay, just one more. Okay.
Just to thank you very much for that. In terms of raising the use of zipline, I know that I work in the system when they were with us about 5 years ago in Lagos, and it's a good thing and something that worth it. But when we couldn't sign the deal, ours is to ensure that people can have access to blood in Lagos State. And logistics became an issue. So we licensed some private logistic companies that give access and part of innovation that in any part of Lagos State, you source for blood and they will help you take blood. Firstly, with the private hospital, from private blood bank to private hospital. As of today, they have increased to 3. With the hope that maybe later, Sydney will come online. One of those things that was mentioned at the last conference is the life bank that started with us, we license it. So it's something that is good, and I believe we can continue to improve on innovation. Thank you.
Thank you.
Absolutely. So Life Bank is a local company that does this as well. So they use bikes, boats, etc. Yeah.
Very simple. Okay. Twofold my comment really. First, I really agree with what you said about PPP because I'm working on 2 projects and I've got to the pilot stage of 1. The second project, I'm still in discussions with the partner, and the question they asked me is if they can bring the product to market, how do they get an investor? I think you're in a good position to answer that. I don't even have to answer it now because of time, but it's something we can probably speak about later. Yeah, I just need an answer to that process, which I haven't done. Thank you.
Yeah, happy to speak after. Yeah, okay. Thank you so much.
Sorry, just.
Okay.
So it's not really a question, but I would like to commend you for the presentation. It was really good and well defined, especially with the data that you presented. So I'm just more interested if I can have the sources of the data so I can dig deeper on the numbers. Maybe after I can just approach you.
Absolutely, yeah, happy to share that.
Thank you.
Great, thank you very much. Please let's put our hands together.